Hello, welcome back to my channel. It is time for another update. I have had my angiogram, my cerebral angiogram. Today is Thursday and I had my procedure on Monday. So it's been a couple of days. I'm still recovering. My procedure didn't go completely as planned, and therefore my recovery has been a little bit rough. And I wanted to share a little bit about my experience. But before I did want to make sure that I clarified that this is not a typical angiogram experience. Mine had some very minor complications, and I don't want to scare anybody from getting it done. Even with my complications, I'm still really glad that I did it. I got an official diagnosis. We figured out how to get me help, what my options are in the future. And so it just kind of gave my medical team and myself more of an awareness of what's going on. So I just wanted to clear that up in the beginning before jumping into what happened and what my experience was. So we'll start a little bit before I had my procedure done. So a couple weeks before my procedure, I met with a neurointerventionalist, and he did a MRV. An MRV looked at like the sinuses, I guess you could say, in your brain, to see how the blood flows through. And before being referred over to him, I had already had two done, and both showed severe pinching. It's actually like where the pinching is like behind my ears. That's the two main areas that drain the blood out of your brain, and to send it back to the heart to be pumped into the lungs to be reoxygenated. That is not a real term, but that's my way of describing it. And both of my areas were pinched off in the MRV. Now, the MRV is not a live time viewing. Sometimes pictures can look worse or better. So we didn't really know exactly what was going on, but we were like aware that there was an issue with that scan, and we did it twice, and both times it showed the pinching. So that's when I was referred to him. He is a really good doctor. I'm really glad he's my specialist. And he said that likely with how severe the pinching looks just based off the picture, eventually I will need a stent, that eventually Diamox probably won't work for me, and my optic nerve will probably get worse, even though right now it's gotten a little better. Now he's like, that could be in a couple months, that could be in 5 years. You don't know. You can't guarantee when it's going to fail, but he's like, I'm pretty sure just based off of this, you're going to need a stent at some point. So I made the decision, I want to do the angiogram now, so we have answers now. So when that time comes, we can just do the stent. So we don't have to worry about a diagnostic and then a separate procedure immediately following as like an emergency situation. I wanted to be like ahead of the game. So I made the choice to do the angiogram now. That happened on Monday. So I was told ahead of time that the angiogram will be done through my leg, because it's basically what an angiogram is where they go through an artery, and they go, for me it was a cerebral angiogram, so they went into an artery, and this little like thing went through the artery all the way up to my brain, and basically they could take live view x-rays of my brain. They could put dye in and see the dye in live time, how fast it was traveling through my brain, where it was getting pinched off, how fast it took for it to go through. They were also able to take measurements in my brain. So that was what was expected. So I had read in my own research, they can go through your neck, they can go through your arm, they can go through your leg. So when they said leg, I was like, okay, cool. And so I thought I was preparing for my like actual thigh area. Like I never clarified with the doctor what part of the leg they were going into. So I just assumed it was a thigh, because I have experience selling steel chainsaws. And we are taught in Steel Academy that there are arteries in your leg that are very dangerous and are often cut with chainsaws if they're not handled properly, and that's why you wear chaps, to protect those arteries. So I thought, oh, if there's an artery in my leg, it'll probably be my thigh. So I shaved from my knee to like my thigh area, like my upper thigh, but like not any higher. Well, it was actually my groin. And I did not prepare that. So I was horrified when the poor nurse, well, he was great. Okay, so I probably should backtrack a little bit, but keep that in your mind. That was my prep work that I did, is I shaved my upper thigh. That's it. So I go in the day of the procedure, I check in, immediately they take me back, they hook me up to an IV, they prep me. By prepping, they basically had me talk with the neurointerventionalist. I met all the team. They talked about how they're going to be giving me certain drugs during the procedure. I talked about my allergy to aspirin and ibuprofen and how I did not want anything too crazy because I was a little fearful about having reactions to it. And I also told them that I do get really nauseous I know I wasn't being put under for this procedure. I knew I was going to be awake. But every time I've been put to sleep for a surgery, what is that medicine called? I cannot think of what it's called right now, but the medicine they use to put you under, I get really sick with and I throw up like the rest of the day. So they knew ahead of time that I get nauseous with medications like that. So they actually had available anti-nausea medication in case during the procedure I felt like I was going to throw up. So they put me in the gown. They told me, I met with the doctors. They wheeled me over to the surgery room. And I remember being very cold for obvious reasons. Like I know coldness prevents like spreading of germs and whatever. But I remember being very cold. I was on a gurney, so I had plenty of room in the bed. But they were going to move me to like this board that was really narrow. And so the nurse was like, I don't want you to move. She's like, I know you can get up and hop on the bed, but we need to move you because once you're on this, if you move too much, you will fall off. Like it's like she said that many patients feel like they have more room than what they actually have. So they picked me up, put me on the bed, and they literally strapped me like right across my chest onto the board. So like this part wasn't moving and I'm laying flat, so I can't see over my chest. So like that in a way was really nice. I think it saved me from a lot of like horrific scenes. So I couldn't see below, but I could pretty much tell what was going on just based off of research I'd done and knowing from my own research how the procedure usually works. I kind of knew what was happening. Plus they were pretty, like, they were open with me. They were like, hey, we're gonna put the numbing in your leg and we're doing this. So at this point they had strapped me to the board and I'm laying in the bed and I still have my gown on. This is when I discovered they're going in through the groin that I had not prepared shaving wise. And they weren't sure if they were going to need access to both sides of my groin or just the right side. So they had to shave both sides of my groin. Basically, this nurse, who also happened to have the same name as me, which was really cool, this poor nurse had to shave my bikini line, basically. And he was really good about it. Like, well, work-wise, he did a really good job. But, like, he was very, like, he didn't make it awkward. Like, I was just embarrassed because I was like, oh my gosh, like, I wish I could have been put to sleep. Like, that's kind of how embarrassed I was. Even though, like, I've had a baby and I've had instances where work's been done down there, but, like, that was just, like, a moment where I was just like, why am I here? I don't want to be here. That was done. They shaved it. Then they sterilized the area. So they put this, like, green scrub on my, like, thigh to pubic area. It was all green. They warned me that, like, look at the sponge, it's green. I'm scrubbing your area. This is so that we can, like, tell where your skin is because they're going to be, like, poking and stuff. So then they put this clear film over that. So there was, like, this giant clear sticky film over me that I couldn't really feel the film on me. I just remember it being there when they pulled it off. So, like, I knew that was there. They also had a blanket over the top part of me. It might have been on my legs too. I just remember it being cold in there and me shivering a lot, but I think the shivering was anxiety. I did get the medication that like kind of put me out of it. So in the beginning, I was kind of like in and out of like drowsiness, but there were multiple times where I would wake up like fully conscious, and not that I wasn't like trying to run away or anything, but when I would wake up and I was like kind of like more aware of what was happening, I would get anxious and I would like start shaking really like uncontrollably, like almost like hypothermia. So then they would give me more medicine. I did get nauseous. I don't know if the nurse gave me too much or if I don't really know why I got nauseous when I did. She probably didn't give me, it probably like was nothing on her end. It probably was just me maybe repeatedly getting the medicine, but I got to a point where like I felt really like sick. And I was just like, I couldn't get the words out that I feel sick. I was just like, I don't feel good. I don't feel good. And that's not something you necessarily want to say when people are like operating on you. So the nurse luckily like knew ahead of time. She's like, all right, I'm giving her the medicine to help with the nausea. And luckily that helped. As soon as like it hit the IV, I was like much better. And I pretty much was conscious. Like the beginning I was a little drowsy. So basically when they poked my area and they like put the thing in, I remember that happening, but I was more like in and out of consciousness for that. The rest of the procedure I was wide awake for. After they got up, they started the procedure. They had put dye in the right half of my brain and was watching it on the things. I couldn't really see the TVs. I knew they were there, but I couldn't really see them because of like where I was at, and there was a machine here. So like I couldn't see what they were seeing, but I could tell it was happening because they were of course talking to me, but also I could feel like when they put the dye in, it actually was kind of painful for me. Which finding out after, I did have heightened pressure in my head. So I think adding the dye with the heightened pressure is probably why it was painful. I did get the eye vision pieces of my vision blacking out. I did get ringing in my ears. So like common high pressure symptoms. So likely the dye just kind of added to it. And that's probably why I was experiencing that. There were a couple times where it was a little painful and uncomfortable, but nothing that I couldn't handle. I wasn't like squirming. It was nothing where you would be like, get this out of me, I'm done. It was just like uncomfortable, like excess pressure. You can kind of tell there was something in your body that wasn't supposed to be there. So that was like the worst part of it. After they did the dye, they tried to do a pressure reading on my right side, and the machine wasn't working. It wasn't reading the pressure correctly. So this is the first complication where they couldn't get the machine to work. Everything else was working fine. Just the pressure reading like wasn't working. There was something about wavelengths I remember hearing a lot about. And at this point, because I was conscious, I began to shake because I was getting anxious. Not because anything was wrong, but I felt like I was messing up. I don't know why I thought that, but I started to shake like uncontrollably, feeling, and then I thought I was the one ruining the machine because I was shaking, thinking that was affecting somehow the reading system. Like in my mind, that made sense at the time. Now that's like not really logical thinking, but I guess you don't think logically when you're anxious. So I was shaking uncontrollably and I was trying to stop it. And anybody with anxiety can say like, if you're shaking and you're already in that state, you can't just like stop it. So the nurse did try to give me more medication, and for some reason it didn't like do much. I think she was trying to be careful with the dosage because I had already gotten nauseous once. But for the most part, I was very conscious of what was happening. It took, I don't know exactly how long, but I do know the surgery took way longer than expected. The surgery started at 8. I didn't get out until like 12. So normally it would be like 1 to 2 hours, and it was way over that. So I don't really know how long it took to get the machine fixed, but it did take a while. And I remember it feeling like forever being just strapped to the table and feeling like that shaking. But eventually they got it fixed. They were able to do the pressure readings, and I could hear the numbers, and I knew the numbers were different. I knew that I had higher pressure before and lower pressure after. But like in my mind, I was like, oh, well, I'm still like, there's still something draining, so maybe they won't give me a stent. So I didn't like know what to make of the information. They were like talking to each other. Plus there's also like medical lingo that they were saying that I was just like, I had no idea what I was doing with that. So I was trying to like decipher the information, but I was a little bit out of it and very anxious. So I was just kind of like waiting for it to be done. Also, at this point, by the time they got the machine fixed, the doctor said, we're about 70% done. We just got a little bit left to do. I had to pee really, really bad because they had an IV on me since I checked in that morning, and the surgery was delayed by a couple hours because of the machine not working. But you can't just like pee in a sterile environment. Like, I know pee isn't like inherently like full of bacteria or anything, but you're still not supposed to just like pee like without a catheter or anything in. And the nurse was like I told the nurse, I was like, I know now's not a good time, but I need to pee as soon as we get this over with. Like, it's like, I need to go. And so she was like, okay. She's like, if you really, really, really have to go, we can do a catheter, but there's risks because you have a higher chance of getting a UTI, which can lead to a kidney, which can lead to sepsis. For those of you who don't know, I actually have had sepsis before and nearly died from it. I thought I had the flu, and it took getting 106-degree fever in my bath, like my shower, just that door right there, nearly dying in my bathtub before realizing it wasn't the flu and going to the hospital and getting antibiotics. So I was like totally on board with just holding my bladder and waiting until after, not getting the catheter put in. So they were able to finish the procedure, but I still have the device in my groin. They have to pull that out, but now you have an open artery once they pull that out, and they have to put pressure on the artery. They also put a blocker, I believe it's collagen, I think is what the nurse said, where they put that in the artery, I believe, and it's supposed to, it's a type of material that dissolves on its own, and it slows down the bleeding, I believe. It's supposed to do something to help with the healing of the artery. That way it's not just like healing on its own, because arteries bleed a lot and they can take a while to recover. So they put the blocker on after they pulled it out, and they had to hold pressure on my groin for like 15 minutes after. Keep in mind, I have to pee. So this was excruciating and felt like, I don't even know if it was 15 minutes, but it felt like an hour, even though it wasn't. I just really had to pee. So they finally get the bleeding to stop. They put a bandage on it. They transfer me to the gurney, and the nurse is like, I know you have to pee. I'm getting you a bedpan. She put a bedpan under me. It was really hard, but eventually I peed in that bedpan and I filled that sucker up because I had to go so bad. And even though I really tried to keep my right leg straight, bedpans aren't easy to pee in, especially if you are trying not to move because you just had your artery opened. So I think the doctor believes too that this is where the second issue happened. So keep in mind, I peed in a bedpan that goes under you and lifts up your groin area, and they just closed my artery. So they bandage it all up. The nurse takes the pee, dumps it, takes me to the room that I will be recovering in. Usually you're in there for like an hour or two after. They just want to make sure you don't keep bleeding. They check on you regularly, and then if you can walk and it doesn't bleed, you're good to go home. They transfer me. The surgical nurse is talking to the nurse at this other station, talking to her about what had happened, where the procedure was, and how the procedure went, etc. So the new nurse doing her job she like pulls the blanket back and looks at the site and notices there's more blood than there should be, and talks to the surgical nurse and says, was it like this when she left the room? And the nurse is like, no, it wasn't. So the nurse immediately puts pressure on the site to try to stop the bleeding. And I couldn't see it because I'm laying flat, but I felt blood squirt out of my leg and like over my entire lap. Like, it almost felt like I not like peed myself, because pee would just be the crotch, but like warm fluid just all over my lap. It was really freaky to feel, especially since I knew I knew it was happening, even though I couldn't see it. And I'm really glad I didn't see it. I probably would have passed out if I would have seen it. But there's at this point like 3 nurses come in. The surgical nurse and the nurse working at the station were both trying to pinpoint, because there was so much blood, they couldn't find the site where the blood was coming from. So they're trying to wipe off the skin to get to the point. But if you don't know, your artery bleeds a lot really quickly. So it's hard sometimes to find it. So it took several attempts. One's trying to call the doctor, and I had just gotten into this little room, and like, it's not like a room, it's like your own little curtain area. And the front curtain was wide open, and they're all looking at my crotch trying to find my artery. So I am freeballing it, to all the passerbyers walking by this area. And not everybody, are like my neighbors who are also in the hospital, not all of them have their curtains closed. So anybody could see not only what was happening, but my business, my vagine. So it's funny now. It wasn't funny at the time, but it's funny now. And I wasn't worried about that, but it's just funny looking back to like thinking about like the poor people who had to witness that. This male nurse walks by who is like not a part of like he's part of the staff obviously, but he was with another patient. He walks by and you can see him like corner of his eye and then like looks over like, wait, what is happening? And then he goes back and he closes the curtain for us because clearly this is not a site for just, you don't want everybody to see this. It's not PG-13 by any means. And they got the bleeding to stop and the doctor was already called. So he was running down, trying to get back to see what was happening, to see if I needed to stay longer. And they were able to get the bleeding to stop. I didn't need to stay the night, but I did need to stay at least 3 hours to ensure that it wasn't going to keep bleeding. So every half hour, by this point I'm sore, right? They had just taken the thing out. They had already put pressure on it. All the other nurses were trying to find pressure. I have bruises all around the area, I think, because of like because you're supposed to push really hard on that artery to get to like stop. Where the nurses were trying to find the site, they were pushing, and so they have like little bruises all around it where they were trying to locate where it was coming from. So, and after the nurses were able to go, because I had stopped bleeding, the nurse that was assigned to me couldn't leave my room, and she had to check on me every half hour, and she had to put pressure on the site to see if it was going to gush blood, and she had to check around it to make sure blood wasn't pooling under the skin. So I was very sore, and every half hour she had to push on it, which made it extra sore. So here I am several days later, and I am still hurting. Like, it hurts to walk. Like, I can't use my right leg at all. Like, driving is like not even possible at this moment in time. But after the nurses got me all cleaned up, Chris was able to come, my husband was able to come into the room finally, and it was 12 o'clock, and he had waited in the waiting room since like 8. So he was like, I was told like I'd see you in like an hour or 2 hours, and now we're like 4 hours later. Like, what happened? And so I'm trying to explain to him what's going on. Not doing a great job at it, but he got the gist of it. He was able to understand. The nurse also helped me a little bit. And then finally it came to the time where I could go home. And so she's like, you can't leave until you can walk around the little hospital room here, and like around the, like by each person's room area, like the hallway, and back. And then I'll check in. If you don't bleed, you can go home. So Chris is helping me, and it was so hard to walk because at that point I've been laying flat for like all morning. So I'm kind of stiff. I'm sore. I don't feel good because I had the medication, and so I'm trying to walk. And at this point, any like numbing or anything like that, I haven't had anything. So like no pain relief. So it's just like what had happened is just there, and it just hurts. So I'm trying to walk. Chris is like my cane, and we get back, no bleeding. I'm able to go home. I think we finally actually left the hospital about 5-ish. So it took longer than like what we had expected, but it was okay because, you know, I was safe. I was fine. We were able to leave. And so recovery wise, I've been doing great. The site has not bled at all. I've been keeping it clean. I couldn't get the site wet for 24 hours, sorry. And after 24 hours, I changed the bandage. I took the old one off. I did it in the shower. You can't soak the site, but you can run water over it. So I was able to get the bandage off. I didn't want to rub soap directly on it, but I washed my hands really good. And then all around the area, I washed really good. And so rinsing it, I felt like was a good enough job. Plus, it doesn't look infected. It's not oozing. It's not red. There's no blood coming out. So as far as that goes, I'm good. I'm recovering. The results of the angiogram were astounding. Basically, my left side is worse than my right as far as the pinching goes. On the highest, like, so before the pinching, pressure is almost at 40, which if you remember, that's about where it was when I had my first lumbar puncture. Normal pressure is 20, so that's already high. after the pinching, it was measuring at a 14. So the differential is drastic. My doctor was saying that normally you wouldn't want to see any pinching where it's a difference, but they consider any differential over 8 to be severe. And I'm almost triple that number with my differential. So I have severe pinching, and it's on both sides, but my left side's worse. I can't remember my right side's numbers, but they weren't that far off. Yeah, so I qualify for at least one stent. He does believe it's possible with how bad it is. I might need to get another one placed on my right side in the future. But for sure, the first one they're going to do at least on the left side. And depending on how I am at that point, they might do both, or they might do one and then do the other one later if I still need it. Recovery. I've had a pressure headache since the procedure. My vision's been cutting in and out since the procedure. I talked to my neurointerventionalist on the phone, and I guess that's really common the first couple weeks after your cerebral angiogram. I was told that, of course, if the pain gets worse, if I'm having symptoms of a stroke, anything that I find questionable or concerning, go to the ER. But right now I'm just kind of there with just a headache. So I did call my neurologist, and we're probably going to be switching up my medication. So I might change Diamox. I don't know if they might take me off Diamox. They might keep me on it. They might up my dose. They might try to lower the dose. I am starting. If you know from my last video, I love Diamox. It's helped me a lot. I have some symptoms like I talk about my last video, but since that video, I have started to have stomach pains. I don't want to eat because of the stomach pains, which is causing me to lose weight fairly quickly, which is not healthy, which is causing me to get chills. Not just anxiety chills like from the procedure, but like I'll be home on my couch, the thermostat set at 70, and I can't get warm. So I also had really low potassium levels before the procedure. So we have to look into ways to get me healthy because we don't want me unhealthy. That's the whole goal of getting treatment. So as of right now, that's where we're at. I will let you know when something changes or when I get an update. But yeah, I might do a more in-depth video of recovery, but I'm still in that process. I'm still recovering. I definitely have been thinking of tips and tricks, like things I wish I would have known ahead of time, because I did not know how brutal this recovery was going to be. But keep in mind, I had a little complications. So I'll see you guys in my next video. Hopefully I can post it soon when I'm recovered, and I'll see you guys then. Bye-bye.